Everyone's familiar with the risk of injury in youth sports, but what you may not know is there is a risk of overuse injury or burnout when it comes to kids in sports. Dr. Johnny Faircloth is with us this morning. He's going to tell us a little bit more about that and why that is. Welcome.
Thank you for having me.
Yeah.
Overuse injuries in youth sports and burnout in youth sports is a hot topic lately. Everyone knows that sports participation offers many benefits to youth, including socialization, fitness. However, lately it seems like there's been more of a emphasis on competitive nature of sport and winning, rather than on fun and skill development. The problem is people are focusing more on increased intensity at an early age, and this is leading to overuse injuries.
What are some of the overuse injuries you're familiar with seeing?
Well, there are multiple overuse injuries in sport. However, some of the high-risk injuries would include stress fractures of the shoulder, the hip, the lower leg, and the foot.
Okay. Is there a certain age group that you tend to see this with more than others?
The risk is during the growth period, the growth phase of adolescence, and so we see it more in early and middle adolescent children.
All right. Well, I do know that a lot of kids, they're pushed by parents. We need to focus on that sometime, don't we? But this does happen a lot. What would you recommend parents do, or even coaches, to help keep this from happening?
There are many things that can be done to prevent overuse injuries in athletics. The important things would be limiting participation both weekly and year-round to no more than 16 hours per week or no more than 10 months out of the year. Things like making sure the children have proper equipment. Nutrition is important. And the most important thing, I think, is for parents and coaches to emphasize skill development and fun rather than on competition and winning.
Right. Sometimes it is all about that, isn't it? I know that rest is important. Do you recommend supplements or anything like that for kids that are trying to recover and keep from getting injured?
Well, that's a good question. The majority of time, if the child is eating a good, healthy diet, there's no need for supplementation. Really, we see these injuries when they overdo it and there's not enough rest time for adequate recovery and adaptation to the sport.
All right. And what can be the outcome if they don't slow down and take care of these injuries?
Some of these high-risk injuries can decrease your ability to participate in sport and even threaten future participation in sport.
All right.
Yes.
Doctor, thank you so much.